Good morning, Dr. Joe from the Hope Brain and Body Recovery Center. And today I want to talk about brain pain. Brain pain. Think about that. Brain pain. We just did a set of videos in our office with patients that have been very successful. I don't think we have a patient that's not been successful in our office. And the idea that chronic pain, whether it's in the low back, and chronic means long-term pain, unremitting pain that doesn't go away no matter where you go, no matter what doctor you see, it's there. Low back pain, unremitting, severe low back pain, foot numbness, knee pains, hip pains, shoulder pains, elbow pains, wrist pains, jaw pain, neck pain, headaches, migraine headaches. If you think about pain, we always look at the pain. Where is it? Okay, it's low back. Let's look at the low back. Let's treat the low back. Let's treat low back some more. Again, surgery, shots, exercises, orthopedics, everything under the sun. And then when you step back, when a patient comes in with chronic pain, I've learned over 30 years and doing Dr. Ted Carrick's work with functional neurology, a wonderful degree that we get in functional neurology, just absolutely fabulous. You step back and you start looking at the entire person, not just the low back or the knee or the shoulder or the elbow or the wrist. And when you understand the role of the brain in its function of muscle control in your core, muscle control around your shoulder, elbow, wrists, hip, knee, ankle, low back, upper back, neck. If you understand that when those controls, when the brain says move and nothing moves, and when the brain says don't move, nothing stops moving, then you get a lot of symptoms in your body. And I would say the vast majority of people take an orthopedic route. Stretch it, put heat on it, laser it, electric stim, ultrasound, shots, more shots, to manage the pain when all the time it's coming from malfunctions in your brain. Yesterday, we had a young man come in with shoulder problems. And after he's had problems for years. Problems in sports that he was doing as an athlete. And really, treating the shoulder never did anything. In a few short minutes of working his brain and working the weaknesses and dysfunction that we saw through our assessment, our brain scan, he got strength back in the shoulder. And we're talking years where he didn't have it. 7 years in which he suffered with the same problem, and it was all due to the brain. And when you do further research into this problem, you find out that people have traumas from the past that finally result in the brain breaking down enough so they don't control that area properly. And the frustration about going to doctors, and then you give up. And you give up, and then I'm going to live with this. Nah, no living with it. So, if you have a problem and you need help, come to our center. It's the Hope Brain and Body Recovery Center. We'll recover you. Number 610-544-9800. We're in Chasford, Pennsylvania at 6 Dickinson Drive, Suite 310. It's Building 300. And we look forward to getting you better. and getting your life back and transforming you. Now, the last thing that I want to tell you about is that these chronic pains, this brain pain that you're experiencing, affects your emotional life. Mood swings, anger, anxiety, depression. People deal with all these things. So when they come in, they're not talking about their mood swings, their anxiety, their depression. They're talking about the pain. And when we find that the brain's the source, you have brain pain, you have a hurt brain that needs to be rehabilitated, then it changes. And it changes dramatically for you. And then you feel better emotionally. You feel more stable, less anger, less mood swings, less anxiety. You sleep better, and you perform better physically. So come on out. Let's do a brain scan. Let's use the great technology that we have in our office to get your hurt brain better so you have a healthy brain and you have a better life. Thank you. Have a great day.